Hi everyone, welcome back to my YouTube channel, The Breast Cancer Physio. I'm Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this video today, I'm going to be walking you through the current prevention guidelines on lymphedema. Lymphedema is a nasty side effect of breast cancer treatment when you've had lymph nodes removed from your armpit or when you've had lymph fields radiated in the armpit or the chest wall. If you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give this video a big thumbs up and leave a comment in the section below because I'd love to hear from you and find out what topics around breast cancer you want more information on. So without further ado, let's get into this video, current prevention guidelines for lymphedema. Topic number 1, skincare. The first thing to talk about here is the fact that the lymphatic system is actually part of our immune system. So if you've had lymph nodes removed from your armpit after breast cancer, then the skin on the arm where you've had lymph nodes taken is forever mildly compromised in terms of its immunity. So what this essentially means is that if you get any skin breakdown on that arm, you want to monitor it closely for signs of infection. Signs of infection include pain, redness, swelling, heat, and things like pus as well. So if you have any suspicion that the wound on the arm that is on your affected side, meaning the side that you've had lymph nodes taken from or radiated, then definitely get down to your local GP and they should be prescribing prophylactic or preventative antibiotics so that that infection doesn't become a full-blown infection. What we want to prevent here is the risk of cellulitis starting. Cellulitis is a broad skin infection which can land you in hospital on an IV drip for about a week and it makes you feel pretty rotten. So the idea here is that we are trying to prevent a bit of a tiered process, meaning that if we do get skin breakdown on our affected side, meaning the side we've had lymph nodes taken from or radiated, that we're trying to prevent an infection starting, which could trigger cellulitis. The problem with cellulitis starting is that this could trigger lymphedema. So it's a bit of a tiered process as I described. You've got to have skin breakdown, which then becomes infected, which then turns into cellulitis, which then triggers lymphedema. However, when this process does occur, it can sometimes fold like a domino set and it can happen very quickly. So the main take-home point, and the most important point probably of this entire video, which I'll tell you right at the start, is that if you have had lymph nodes taken from your armpit, then please be sure to monitor for any skin breakdown. Let's just quickly talk about different types of skin breakdown. What we're detailing here is anything from when you fall over and you cut your skin, or if a cat bit you, if you... Another example of skin breakdown would be if you got bitten by an insect or a spider, particularly where we are in Australia at the moment. Mosquitoes and midges are a problem. So if you get any sort of bite, cut, graze where a bug could penetrate the skin, then monitor it for signs of infection, and at the first signs of infection, get down to your local GP and get them to prescribe you some prophylactic antibiotics. Another topic on skincare is that if we are going outside for long periods when the sun's out and we are at risk of sunburn, it's best to cover the arm with a long sleeve t-shirt and or using regular applications of sunscreen. The last thing we want to do when we're at risk of lymphedema, or if we already have existing lymphedema, is to spike lymphedema by getting any sort of extreme sunburn. So make sure you cover your arm with a long sleeve t-shirt or apply sunscreen or both on a regular basis when you're out in the sun for extended periods of time. A really important point on skincare is to do regular moisturizing of the arm. So what we recommend is that once a day you moisturize the skin on the arm that has had lymph nodes taken. Of course, you're welcome to moisturize anywhere on your body, but if there's one thing you do on a daily basis, it would be to moisturize the skin on the arm that has had lymph nodes taken. The reason we do this is because the best way to prevent skin breakdown is to maintain skin integrity, and the best way to do that is to keep the skin hydrated. So I've just got some examples here of the types of cream that we generally recommend to use when you're at risk of lymphedema. We have got Sorboline, which is a really common cream that people use. The majority of these creams are water-based and not oily, which can attract dust and get quite sticky. So SUNBURN is a really basic brand that is water-based, low pH, and barely causes any sort of skin irritation that I've ever seen in my years of specialising. Another cream that is commonly used is QV. These are all creams, obviously, that are based in major supermarkets and chemists in Australia. So there's most likely equivalents in other countries, but these are just examples from Australia. The third example is one of my favourites, which is Mugu. This is an all-natural product, and this is a fantastic moisturiser. All of these moisturisers, by the way, can be used during radiation. So this is another reason why these brands are particularly helpful, because if you are about to go forward and have radiation, or you are going through radiation, all of these creams can be used during radiation. Another really important point about keeping the skin hydrated is to drink plenty of water. So you don't only have to moisturize from the outside, you can moisturize from the outside in, so or the inside out, I should say. So make sure you are consuming plenty of water to keep your skin healthy and hydrated. And again, this all comes back down to the same topic. We are trying to prevent skin breakdown to avoid triggering lymphedema. A really important topic in this video is the question that I often get asked, which is, what do we do about blood pressure testing and needles on the affected side? Now, of interest, just of late in 2020, I've had a fair bit of pushback from some medical professionals on this topic as to whether there's any research to back up the fact that we ask patients to avoid having blood pressure cuff testing and needles on the affected arm. So what I recommend with this topic is that if you've got a good arm to use, i.e. you've got an arm that hasn't had lymph nodes taken from it or radiated, then I would advise using the good arm in as many circumstances as possible. So if you have to have a blood pressure test done and you've had lymph nodes taken off your left arm, then I would recommend you always do it on your right. Now, on the topic of blood pressure cuff tests, I've never actually had anybody present to my clinic that has had lymphedema triggered immediately following a blood pressure test. However, it is in the literature that there have been cases of people who have presented with lymphedema that they suspect has been triggered by a blood pressure cuff test. So it would be my advice to use the opposite arm if you can, i.e. meaning the arm that doesn't have lymph nodes taken. The other option is that you could use a blood pressure cuff test around the ankle if you've had lymph nodes taken off both armpits. The ankle blood pressure cuff tests don't tend to be as accurate, but if you really wanted to avoid it being done on your arms, there is an option of having it done at the ankle. Then there's a separate question around injections, vaccinations, and blood tests. Again, my advice is the same. If you've got a good arm to use, then use your good arm. But if you really need to have an injection, my personal take on this topic is that it's not actually the penetration of the needle that's the problem. It's when you get a needle stick injury. Needle stick injuries can often create bruising and inflammation around the site where a needle stick's tried to penetrate the skin and it's gone wrong. They haven't been able to find a vein or whatnot. So my take-home message, as I said, is the same. Try to use the arm that has not had lymph nodes taken. But if you really need to use an arm that has had lymph nodes removed, we would try to make sure as health professionals that we do as smooth an injection as possible, or blood being taken. If you happen to forget that you had lymph nodes taken off an arm and someone accidentally takes, say, a blood test on the arm that has had lymph nodes removed, I don't think that's necessarily a reason to panic. I think you would monitor your arm for signs of swelling for the next 24 to 48 hours, but at the end of the day, where I see lymphedema triggered is often when there's needle stick injury occurring rather than just the penetration of the needle itself. There is, of course, the very small risk that you could get an infection from the needle literally just penetrating the skin. This is a very low risk, but again, same take-home message. If you've got an arm that's not had lymph nodes taken, then use the other arm. So essentially the take-home message is the same. If you've got an arm that hasn't had lymph nodes taken, then try to use that arm. There are certain types of needles that I would really try to avoid at all costs if possible. If you need to get a vaccination done, I would avoid it on the arm that's had lymph nodes removed, or if you need to have an infusion done, such as a Prolia or as a Meta injection. These are injections that takes a considerable amount of time. So fluid being pumped into an arm that has had lymph nodes removed is probably going to be higher at risk for overtaxing the lymphatic system. So see if you can avoid vaccinations and infusions on the arm that's had lymph nodes taken. Travel. Now, there are recommendations around what we should do with regards to preventing lymphedema when we come to traveling. So if we're going on a plane flight that is longer than 4 hours in duration, we would recommend that you wear a prophylactic compression sleeve on the affected arm. So if you've had lymph nodes taken off your left arm, we would recommend that you wear a sleeve, a compression sleeve that is a properly fitted compression sleeve with the right grade of compression that is well fitted. Ideally, you would get it fit by a physiotherapist or an occupational therapist who is well experienced in looking after patients after breast cancer and lymphedema. And you can use this sleeve for the duration of the flight and then typically for an hour after the flight finishes. In the same context, we'd also recommend that if you're going on a really long car ride, that the sleeve would be worn for that duration of the car ride. So if you're going on a car ride that's more than 4 hours in length, we'd also recommend that a sleeve should be worn for that. The main reasons behind this is because of the stagnant nature of these activities. So typically when we sit down on a long haul flight or in a car ride, particularly if we're the passenger, we're not moving very much. And the interesting thing about the lymphatic system is it doesn't have its own pump. It has a pump, but it's a very, very weak pump. So what we mean by this is if you cut an artery, that artery will spurt blood. But if you cut a lymphatic vessel, it will trickle. So the lymphatic system doesn't really have any sort of strong pumping mechanism behind it. So it relies heavily on the muscle contractions that are positioned around the lymphatics to help flush it away. So not only should we be wearing compression garments when we're in stagnant activities like flying or car drives, but we should also consider moving that limb regularly throughout those activities, because keeping that limb moving is going to keep that muscle pump happening and help flush that lymphatic fluid away. Climate. Believe it or not, extremes of temperatures can trigger lymphedema. So there are plenty of scenarios by which if people get in really hot, humid climates, that their arm can swell. Heat can overtax your lymphatic system. Essentially, it can make it work really hard. So if you're in a really hot environment, consider getting air conditioning at home if you can afford it. Make sure you're not going out in the hottest part of the day for extended periods. And I would certainly avoid, doing things like getting in really hot thermal springs, jacuzzis, spas, saunas, steam rooms for extended periods. I'm not saying that we want to take away every piece of quality of life that you've got, but just be aware that extremes of heat can trigger lymphedema by overtaxing the lymphatic system. Interestingly, extreme cold can also overtax the lymphatic system. Where I live, we don't have to deal with extreme cold. We're in southeast Queensland in Australia, but certainly if you're going to a really cold climate like the snowy mountains or ski fields, then definitely rug up and protect that limb that is at risk of lymphedema. I think the difference with cold versus hot is that the majority of the time, if we're going into a really cold environment, we're quite aware of that and we will rug up. It's sometimes a lot more difficult to get into a cool environment if you're in an area where the climate is typically hot. So make sure you've got things that you can do, if possible, to reduce your body heat when you're in the hotter parts of the year. Body composition. This is a really, really important message to be delivered through this video, is that if you are overweight or obese, you are at much higher risk of contracting lymphedema if you've had lymph nodes taken or lymph fields radiated. So one of the best things you can do if you are overweight or obese and you're at risk of lymphedema is to work with a dietitian or a metabolic health consultant to help reduce your body fat percentage. So consider that fatty tissue is a big trigger towards lymphedema. I'll go into more detail on this topic in a separate video, but ultimately, if you are overweight or obese, definitely work towards reducing your body weight. And that will dramatically help reduce your risk of lymphedema. There's also plenty of patients that I've looked after who have been overweight or obese and have contracted lymphedema, and through steady, slow, healthy weight loss, they have dramatically improved their lymphedema. So that's another thing to consider, is if you already have lymphedema, if you're already overweight or obese, there's still things you can do to improve your lymphedema through weight loss. Exercise. Interestingly, one of the ways that lymphedema can be triggered is when we go from doing very minimal activity and then all of a sudden we get right into, 7 or 8 days in a row of really heavy activity. Sometimes people's lymphatic system or their whole system can be so deconditioned, particularly after an experience like breast cancer, by which even a short burst of intense physical activity like shoveling dirt for 2 hours non-stop might also trigger lymphedema. So if you are keen to get back into an exercise program, the slogan we use with this as health professionals is start low and progress slow. Don't dive into going from absolutely no physical activity whatsoever and then suddenly go, right, I'm going to grab the bull by the horns and I'm going to get out there and I'm going to do stuff every single day for the next week, because that can definitely trigger lymphedema. This is not meaning that we shouldn't exercise. There's absolutely every reason to exercise when it comes to lymphedema, but definitely talk to your local physiotherapist or exercise physiologist who specializes in breast cancer and lymphedema treatment, because they can guide you through an individually tailored program to suit what level of exercise you should start at. They will pitch it to your level and you can progress slowly and steadily. That's a really important topic when it comes to lymphedema. I don't see it happen very often because the majority of people that I treat who are at risk of lymphedema are very sensible and they tend to err on the side of caution. So I don't see it often, but when I do see it, it's a dramatic onset of lymphedema when people go from doing not very much activity at all and suddenly burst into lots of physical activity. Thank you so much for watching this video. I hope you've gained some great information on the topic of current prevention guidelines around lymphedema. If you have any questions on this topic, please feel free to reach out or leave a comment in the section below. I release a new video every week around the topic of breast cancer, so stay tuned for next week's video. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.